Hi everyone, this is Carolyn Schechter, and today I'm going to be talking a little bit about aspirin, how it works in slowing down inflammation and pain relieving and blood clotting. So aspirin, or the more formal name acetylsalicylic acid, is a very versatile non-steroidal anti-inflammatory drug, or more commonly called NSAID, used for pain relief, inflammation, and as a preventative measure against heart attacks. This is what aspirin normally looks like here. And here is the chemical structure of aspirin drawn out. It also works as a mild blood thinner, and people with a high risk of heart attack, stroke, and blood clots often take aspirin in low doses daily as a preventative measure. So how does aspirin work? Aspirin blocks an enzyme called cyclooxygenase by competitively binding to the cyclooxygenase. These are more commonly called COX1 or COX2. They're involved with the ring closure and addition of oxygen to arachidonic acid, and they convert them into things called prostaglandins. So I'm going to zoom in a little bit here. This is arachidonic acid here, and the ring will close here to form prostaglandins, which we will talk a little bit more about later. Now, when aspirin binds to this cyclooxygenase instead, the arachidonic acid can't bind to the active site of the cyclooxygenase and therefore can't enter the cycle to become prostaglandins. The acetyl group from aspirin is hydrolyzed. Let's see the acetyl group here, and bound to the alcohol group of serine as an ester, which we can see right here. That inactivates COX1 and switches the catalytic activity of COX2, which prevents arachidonic acid from entering the active site of the enzyme cyclooxygenase, and therefore it cannot become a prostaglandin. Prostaglandins induce inflammatory responses and help form blood clots, which is exactly what aspirin wants to prevent. So because it prevents the formation of prostaglandins, it reduces inflammation, fever, and blood clotting. So we have a few more pictures here. We can see aspirin bound to the serine group here, and it changes the conformation of these enzymes. Now, if it weren't to bind, this is what we would get, these prostaglandins here. As we can see, this creates this 5-membered ring with the 2 oxygens bound. So we're going to talk a little bit more about prostaglandins, but I just want to show you a little bit more of these 2 structures here. So when it binds to this serine group here, it'll change the conformation. And as we know, when something is competitively bound to an enzyme, whatever else wants to bind to that enzyme can no longer do that. And therefore, the enzyme won't act as it is supposed to. So prostaglandins are derived from arachidonic acid by the action of COX1 and 2, as we know. Biosynthesis of prostaglandins increases in inflamed tissues. So the more prostaglandins we have, the more they will keep creating prostaglandins and more tissues will remain inflamed. Redness and edema result from increased blood flow to the inflamed tissue through PGE, which is a prostaglandin mediated arterial dilation and increased vascular permeability. So the more blood flow you get to an area, the more inflamed and painful it's going to be. Now, by competitively binding to COX1 and 2, prostaglandins are not formed as abundantly and inflammation will decrease. That is the mechanism of aspirin. It stops these prostaglandins from being formed, and therefore inflammation will decrease pretty steadily. So that's a pretty basic explanation of how the aspirin mechanism works and which enzymes it binds to. Let me know if you have any questions, and here's a list of my references. I used quite a few for different pictures and explanations of aspirin and prostaglandins. Thanks, guys.